See an NCLEX tips and points video on potential complications in the post-anesthesia care unit. We will be seeing it under the headings System, the Complications and Interventions. The first is the neurological system. The complications in this system are drowsy and hard to arouse, restless, not following commands, confusion. The interventions include check glucose level, hold pain medication, consider naloxone, restrain as ordered, reorient or provide explanation or reassurance to the patient, have family present as possible, evaluate oxygenation, evaluate for alcohol withdrawal. The second system is the respiratory system. The complications in this system include airway obstruction or stridor, inadequate oxygenation, ineffective ventilation, aspiration. The interventions are check airway and oxygen saturation, check breath sounds, auscultate, supplement oxygen as per provider's order, consider ventilatory support, and opt for chest radiograph. The third system is cardiovascular. The complications in this system include hypotension, tachycardia, bleeding, venous thromboembolism or pulmonary embolism, dysarrhythmias, myocardial infarction, fluid imbalance which can be dehydration or retention. The interventions are monitor vital signs, fluid and blood replacement as ordered, for prevention of venous thromboembolism, compression stockings, intermittent pneumatic compression boots, and for treatment of venous thromboembolism, anticoagulation therapy, monitor intake and output, and monitor electrolytes. Next is thermoregulation. In this there can be two complications. If hyperthermia, the nurse need to monitor for malignant hyperthermia, initiate emergency treatment as necessary, including administration of dantrolene or cooling agents, and for hypothermia, provide warm blankets or warming device for hypothermia, provide supplemental oxygen as shivering increases the demand. Next is gastrointestinal. Post-operative nausea and vomiting is a major complication. The intervention include administer antiemetics, anticipate and prevent aspiration if vomiting, head of the bed elevated or sideline position as possible. The genitourinary system, urinary retention is a complication. Intervention includes bladder scan, consider Foley catheter, suggest standing in males when attempting to void when possible. The next is skin integrity. Skin breakdown or redness at pressure points is one complication. Others include abnormal wound drainage, yellow or cloudy, bloody or foul smelling. Severe wound complications such as dehiscence, that is wound rupture along the surgical suture can happen, or evisceration, that is extrusion of viscera outside the body through the surgical incision. The interventions include relieve pressure as possible through positioning and support with blankets and pillows, check amount of drainage, color and frequency of dressing change, reinforce dressing and report to provider. Dehiscence or evisceration requires immediate notification and intervention by the surgeon. Maintain low Fowler's position, minimize movement and cover wound with sterile saline dressing. Last is pain. The complication, persistent pain may lead to deconditioning and respiratory compress, such as atelectasis through decreased mobility, hormonal response such as excess catecholamine production resulting in hypertension and tachycardia, and neuropsychiatric effects such as insomnia. The interventions by the nurse can be, for my pain, non-opioids example acetaminophen and non-steroidal anti-inflammatory drugs, moderate to severe pain, multimodal therapy, non-opioids, mu-opioid agonist, for example morphine, hydromorphine, fentanyl, and adjuvants, example anticonvulsants, local anesthesia, antidepressants. Other pain modalities provided by the providers and supported by the nurses, preemptive analgesia, that is given pre-operatively by anesthesia, and rescue analgesia given post-operatively to supplement the pain medication. Other considerations include multimodal therapy, opioid and non-opioid analgesia to avoid unwanted sedation, regional blocks by anesthesia providers, and systemic or epidural patient-controlled anesthesia. Comfort measures that includes physical or psychological, that includes positioning, heat and cold therapy, sensory aid, socio-cultural, that is including family and caregiver, psycho-spiritual, for example chaplain, and environmental. Hope you understood this video. Thank you so much for watching.